So, hello everyone. Good day, good morning, afternoon, evening, whatever time you are viewing this lecture video. So, we are going to tackle your last lecture in CC1 Lec, which is about tumor markers. So, you're at the end of your CC1 journey. And then next semester, you will be going into second sem na. So, CC2 na yun and very different na yun from CC1. Pero, I hope that what we learn here dito sa CC1, lalo na itong tumor markers ngayon, you will remember it and take it into heart kasi when you go to medicine, lalo na when we study yung mga cancer, mga tumors in medicine. So, itong tumor markers, very helpful din ito siya because a lot of the diseases or cancers in pathology sa medicine will be tackling tumor markers. And also, when you go to work, so you will be dealing a lot of the measurement of these tumor markers. So, I want to congratulate everyone kasi you got good scores sa ating exam sa ating quiz rather sa renal function. So, I hope na sa quiz natin sa tumor markers, you also get perfect scores kasi ako, ang binibigay ko na quizzes yung tinuturo ko naman, di ba? Kasi ayaw ko maging terror na prof. Di ba kasi ayaw natin yung mga terror na prof. Pero, when we go to our exams, so sa exams na, because I will be making the questions for renal function and tumor markers, so I will be amping up the difficulty slightly kasi more on ano na siya dapat understanding, more on analysis, and medyo mas mahirap na yung question. So not like yung ating renal function na quiz which is more on recall lang siya, what is, ganyan. So when we go to our exam, you should study better, study smarter, so that you get good scores kasi ang finals kasi yun yung pinakamalaking bearing sa inyong grades. Okay? So, let's start with our lecture. So, tumor markers. Okay? So, why do we study tumor markers? So, bakit? Yan laging question natin, di ba? Bakit? Bakit siya? Joke. So, bakit natin pinag-aaralan ang mga tumor markers? So, tumor markers, from the name, tumor markers. So, first, tumor. So, what do you think, what is the first thing that comes into mind when you think of tumor or when you see tumor? Di ba? Tumor, mga parang lumps, cancer, 'di ba? Ganyan siya, parang abnormal disease, ganyan, 'di ba? Then what do you think when you see the word marker? So parang marka, parang when you see that mark, you know if there is a disease present or if there is the absence of the cancer. So kaya siya tumor markers kasi yung minsan yung tumor sa ating body or yung cancer sa ating body, we cannot see it outside. So we use the tumor markers because it is accessible kasi na-measure natin siya so that we know if may cancer ba talaga yung patient or ano yung to monitor the patient na may cancer, ganyan. So ito, look at this one. Useful in tumor staging. So yung mga, di ba, stage 1, 2, 3, 4, and then monitoring therapeutic responses. So pag i-treat mo na yung cancer, so ano ba, magtaas ba yung tumor marker or magbaba ba yung tumor marker? Then predicting patient outcomes. So 'di ba, kasi when there is a more complex stage or more advanced disease, mas pangit yung prognosis ng ating patient, 'di ba? And then detecting cancer recurrence. So actually, tumor markers are very invaluable in detecting cancers or tumors. So, 'di ba, mostly naman ng mga cancers natin is detected ng mga biopsy, ng mga ano pa ba dyan, yung mga cell analysis. Pero itong tumor markers kasi very accessible siya. Sa blood lang siya, sa body fluids lang siya. Tapos you get to see if ano na yung nangyayari sa loob ng ating pasyente na may cancer. Okay? So that's why we study tumor markers. So when you see the word tumor tapos cancer, 'di ba, parang synonymous siya, tumor, cancer, parang same lang siya and they are used interchangeably, 'di ba? Pero actually, tumor and cancer is different. So, meron silang difference. So, tumor actually, parang umbrella term siya, parang lahat ng mga cells na nag-abnormally divide or marami masyadong cells abnormally siya nagadami. So, 'di ba? Ito, when you see this one, ito, 'di ba? Dumadami yung cells, naga-cell division sila. So, when there is excessive cell division ng ating cells, kanya sa skin natin, magdami yung skin cells natin, kaya siya parang mag-lump, parang tumor, 'di ba? Tumor, mag-lump siya. Yun siya ang tinatawag nating tumors. Parang ano siya, umbrella term siya, general term siya yung tumor. Pero tumors can be divided into benign and malignant. So yung benign, 'di ba, pag naiisip nyo benign, kaya parang ay salamat benign, parang ganyan, 'di ba? So benign tumor cells grow only locally. So doon lang siya kung asan siya nagagrow, doon lang siya. Mag-grow siya marami, dadami yung cells. Pero hindi siya mag-spread to other parts of our body. So parang kaya nga siya, ay salamat benign, kasi doon lang siya, hindi siya mag-spread sa other parts of our body like ang heart, lungs, brain, ganyan. So hindi ma-affect ang other parts ng body. So madali lang siyang i-treat, okay? Meanwhile, on the other hand, malignant or otherwise known as cancer. So malignant is also known as cancer, 'di ba? So ang benign, yun yung hindi cancer, yun yung parang okay lang siya, madali lang siyang i-treat. Pero malignant are cancer, malignant are tumors. Tumors pa rin siya, tumor pa rin siya. Pero this can invade neighboring tissue. So pwede siya, yung skin natin na tumor, pwede siya mag-invade sa surrounding tissue. And then eventually, when grabe na talaga ang kanyang replication, mag-metastasize. When you see the word metastasize, it will go to other parts of your body. So kunyari meron kang skin tumor. So when you say mag-metastasize na yung skin tumor mo, yung mga tumor cells, it will go to the lungs, it will go to the brain, to our heart, ganyan. So that's why pag sinasabi na hala malignant, hala cancer, kay parang medyo makulbaan ka na kay this is very aggressive na yung tumor ng patient. So when you see the word benign, when you see the word benign or when you hear the word benign, wag kayong makampante kasi other benign tumors can progress to become malignant tumors. Okay, so dapat you should know what is the difference or what are the differences of benign and malignant tumors. Okay, so ito, these are parang characteristics of benign and malignant tumor. So you have to answer kung benign ba siya or malignant. Okay, so what about not immortal? So ano siya, namamatay yung cells. Benign, 'di ba? Then only grows locally. So sinabi na natin kanina, benign. And then not invasive, benign. And then transient increase in tumor markers. So kasi 'di ba namamatay din yung ating cells na nagaproduce ng tumor markers. So there is only a transient increase. When you say transient, parang ano lang siya, nawawala siya. So mag-peak lang siya and then mawawala din siya after. So is it a characteristic of benign or malignant tumor? Benign, 'di ba? So when you look at those four characteristics, 'di ba? Yan yung parang mga characteristics na parang ano lang siya, hindi siya aggressive. Parang passive lang siya. So, hindi siya immortal, local lang siya, hindi siya invasive, and then transient lang ang increase niya in tumor markers. So, when you don't need to memorize it. Parang ano mo lang siya, analyze mo lang na pag medyo hindi aggressive yung characteristic niya, it is a characteristic of a benign tumor. Okay? So, what about immortal na cells? So, yun, hindi na mamatay ang cells. And then, progressively invasive. So, it will invade other parts of the surrounding of the tumor. And then cancer, 'di ba? Sinabi na natin kanina, it is also called as cancer and has the ability to metastasize. So again, metastasize, it will go to farther parts of your body, so far from the tumor, okay? To other organs. And then long-lasting increase in tumor markers kasi nga immortal yung cells niya. So itong immortal until dito sa long-lasting increase in tumor markers, these are actually characteristics of malignant tumors or otherwise known as cancer. Okay? So, take into mind what is benign and malignant. So, ito, what actually causes cancer? So, bakit nagkakaroon ng cancer ang ating body. Bakit nagkakaroon ng cancer? So, ano yung kanyang pathogenesis? Bakit siya nag-start? So, ito, look at this, look at my pointer. Ito yung ating normal, kunyari, normal skin cells na lang, normal skin cells. Ito, normal skin cells. So, the normal skin cells will actually be attacked by inflammation, by environmental mutagens. When we say mutagens, i-mutate niya ang DNA or parang sirain niya ang DNA ng ating cell. And then spontaneous mutation. So mutate. When you say mutate ha, maging sira ang kanyang DNA, maging dysfunctional ang kanyang DNA. Tapos 'di ba, you have learned na ang DNA, that is the parang blueprint of our cell to increase, or blueprint of our cell to parang ano siya, to proliferate, 'di ba? Siya ang nagsasabi na mag-proliferate yung cell, or siya ang magsabi na wag ka muna mag-proliferate cell. Ganyan. Tapos pero there is mutation. There is mutation in the DNA. So hindi na alam ni DNA if mag-proliferate ba siya or mag-stop ng proliferate. So when there is mutation, there will be increase in the number of cells. So mag-divide lang ang cell kasi hindi siya maka-take ng signals to stop proliferating. So mag-proliferate lang siya until magiging malaki na ang ating tumor. So parang when you think of the 'di ba, parang mga tumors sa ating skin, yung mag-proliferate ating skin cells until hindi na kaya ng skin na parang i-contain siya. So parang lalaki na siya at magkakaroon na siya ng lump or yung sinasabi nating tumor, 'di ba? So ayun siya. It will proliferate. Tapos itong mga proliferated cells, ang mga abnormal cells na ito sila kasi 'di ba mutated na ang kanilang DNA. And then it will actually be compounded by our body. So actually may kasalanan din ang ating body why we have cancer. Kasi 'di ba, when you look at this NK cells, itong mga DC, mga dendritic cells, ito sila mga neutrophils. These are white blood cells, 'di ba, in our body. And then yung mga white blood cells natin and other cells in our body, this will release mga cytokines, mga growth factors na mag-compound. So dadagdag siya actually kasi at first gusto niya i-contain yung cancer, 'di ba? Sabi niya, hala, dumadami yung cell, pero i-contain natin yung cancer, so dapat mag-release siya ng mga chemicals, ng mga cytokines to stop the proliferation of the cells. Pero in the long run, magkakaroon din ng dysfunction ito kasi it will release mga growth factors which will actually promote the growth of the tumor. So actually, it is not just the environment or the extrinsic factors that can affect cancer, but also our own cells in our body. And then 'di ba, mag-proliferate na siya, and then ito yung sinasabi ko na metastasis, 'di ba? When it metastasizes to other parts of the body, it will go to the blood. So it will go to the blood kasi 'di ba, the blood can go to any part of our body. So it will go to the blood and then magpunta siya sa other part na gusto niya, sa other organ na gusto niya, and then doon na naman siya mag-seed and mag-proliferate. That's why we have metastasis of cancer. Okay? And then when you have mga genetic na mga predisposition to cancer, that will also help the cancer cells grow and proliferate and metastasize. Okay? So, ito, 'di ba, the normal cells, this will undergo dysplasia. So, ang sinasabi ng dysplasia, maging abnormal yung cells kasi ang kanyang DNA will be mutated. Itong mga violet na colored cells, 'di ba? When you look at the surrounding normal cells, ganyan dapat yung shape niya, pero ito sila, they are different in shape kasi nga ang DNA nila is sira na yung DNA nila, mutated na yung DNA nila. And then ito, carcinoma in situ. When you say in situ, doon lang siya talaga sa site niya, hindi siya mag-invade sa other sa surrounding parts of the tumor. And then invasive carcinoma, ito na, naga-progress na siya, and it will naga-invade na siya ng surrounding tissues. Okay? And then metastasis, again, it will go to the blood or it will go to the lymph, and then it will go to the other parts of our body, other organs of our body, and then doon siya mag-seed, doon siya mag-metastasize, doon siya mag-grow. Okay? That's why we should not take for granted yung mga tumors lang sa skin kasi malay mo, it will go to our lungs, it will go to our brain, and then doon siya sa brain, doon siya sa lungs, yung mas important na parts of our body, doon siya mag-proliferate, 'di ba? So dapat sa ano pa lang, local pa lang siya, doon pa lang siya sa lower stages pa lang ng cancer, dapat i-treat na siya. Okay? So that's why tumor markers are very important kasi pwede siya makadetect ng mga abnormal or cancer cells in our body. So ito, pareha lang yan, 'di ba? Normal cell, and then mag-mutate ang DNA, and then mag-proliferate siya, magdami siya, and then mag-progress siya, and then mag-metastasis siya other parts of our body, and then it will eventually lead to death of the patient. Okay? So ito, what are the stages of cancer? So itong stage 1, mostly lang ito siya ha, parang generalized staging lang ito. Pero actually, there are different stages. Different ang stage ng breast cancer, different ang stage ng lung cancer. Pero ito lang siya, parang blueprint lang ito siya ng staging ng cancer. So stage 1, localized primary tumor lang. So for example, sa skin lang siya, localized lang siya. And then stage 2, mag-invade siya to surrounding parts of the skin. And then stage 3, it will eventually go to the lymph nodes. Okay? Kasi 'di ba, ang lymph nodes, yun yung nag-drain ng lymph from our organs. So yung lymph from our organs, kanya from the skin, lymph from the skin, it will actually, kasi nag-invade naman yung cells doon sa surrounding parts. So ma-contaminate na yung lymph ng ating cancer cells, and then this will eventually drain into the lymph nodes. Okay? So yun yung pag nakita mo na yung cancer cells doon sa lymph nodes, poor prognosis na siya kasi nag-start na siya spread to other parts of our body, and then metastasis, so stage 4 na yun siya. So yan yung naririnig nyo na, stage 4 cancer na siya, so very difficult to treat na kasi masyado na nga siyang marami, masyado na siyang spread yung tumor. Okay? So remember nyo lang yung staging. So ito, you will hear these terms very often when we deal about cancer or tumors. So proto-oncogenes, oncogenes, and tumor suppressor genes rather. So, 'di ba, when you think of the word onco, 'di ba, oncology, what is onco? Onco is cancer, 'di ba? Oncology, study of cancer. So when you say genes, so genes nandoon siya sa ating DNA. So proto is yan yung before, or yan yung ano pa siya, prototype pa siya, yung hindi pa siya na-activate. So actually, the normal proto-oncogene and the normal tumor suppressor genes, 'di ba, tumor suppressor, it will stop the proliferation of tumors, 'di ba? The normal proto-oncogene and the normal tumor suppressor genes, this will keep the proliferation of the cells intact. That's why normal ang ating cells, hindi siya masyado mag-divide ng marami. So dapat yan talaga yung nangyayari sa healthy individual. Normal tumor suppressor gene and the normal proto-oncogene. Pero, 'di ba, as I said earlier, yung genes natin, the DNA natin, this will be mutated by certain factors. So yung mutated tumor suppressor gene, so yung tumor suppressor gene, 'di ba, it is supposed to stop the tumor from growing, 'di ba? It will have a loss of function. So what do you mean by loss of function? So hindi na gagana ang tumor suppressor gene. So kapag hindi na siya suppressed, it will hindi na suppressed ang ating proliferation, it will lead to the proliferation of the cells, 'di ba? So there is loss of function of the tumor suppressor gene. And then the mutated proto-oncogene will become the oncogene. Okay? So yung proto-oncogene will become the oncogene when it is mutated. So yung oncogene, it will have a gain of function. So different siya sa kabaliktaran siya ng tumor suppressor gene. Oncogene, 'di ba? Onco, cancer, it will promote cancer. So there is a gain of function. So mas gagrabe yung function ng oncogenes natin. And when there is a promotion of cancer, there is the promotion of the proliferation of the cancer cells. Okay? So that's why the mutations in our genes will be the factor kung lalago ba ang cancer natin or it will stop proliferating. Okay? So remember niyo yung terms na yan, ha? So, what are the different types of cancers? Ito siya, very general lang ito siya, pero there are a lot of cancers. So, when you go to medicine, you will every organ may cancer talaga siya. Actually, yan siya ang pinaka-hate ko sa pathology, yung mga cancer na part, kasi very difficult to study kasi ang mga pangalan nila, staging nila, mga genes nila, marami siyang ek-ek sa pathology. Pero ito yung mga different types of cancer. So carcinoma actually arises from epithelial cells, okay, from epithelial cells. So remember niyo ha, carcinoma, epithelial cells. And then, for example, basal cell carcinoma, 'di ba? Basal cell carcinoma or squamous cell carcinoma, 'di ba? Yan yung mga cancer sa skin. So 'di ba ang skin natin is made up of epithelial cells. So yun siya. Carcinoma arises from epithelial cells. And then sarcoma arises from connective tissues. So, when you think of the term sarcoma, 'di ba? Yung parang sarcomere, 'di ba? Yan yung sa muscle. I think you have already learned that, yung mga sarcomere, sarcoplasmic reticulum. And then muscle is a connective tissue, 'di ba? Muscle is a connective tissue. So sarcomas actually are derived from connective tissue. Okay? Then leukemia, ito, leukocytes. These arise from bone marrow cells. Okay? Kasi 'di ba asan galing ating leukocytes? From the bone marrow. So leukemia, so pag naririnig nyo yung sinasabi na usually mga bata, 'di ba, they have leukemia. These are actually bone marrow cells. So very very poor ang prognosis niya kasi 'di ba ang bone marrow cells natin is the source of our red blood cells, white blood cells, platelets. And then what if wala kang red blood cells? 'Di ba anemic ka, wala kang energy. Then what if wala kang white blood cells na normal? So abnormal yung white blood cells mo, so you cannot fight off infections, 'di ba? So kaya iyan very deadly itong leukemia lalo na sa mga children. Okay, then lymphoma, lymph arise from lymphatic tissue. Okay, so you can look at it here. 'Di ba itong leukemia, ito, 'di ba red blood cells 'yan, and then ito mga abnormal cells 'yan siya. That is leukemia. Okay? Then ito epithelial cells, connective tissue, so you can look at that. So I will give you an overview of the cancer in the Philippines. Pero ito siya, it is actually 2015 pa. Pero mirrored naman ang kanyang until now, ganito naman pa rin ang kanyang incidence or epidemiology ng ating cancer. So actually, sa both sexes, ang breast cancer ang pinakamarami dito sa Philippines. Second lang ang lung, and then colon, and then liver, and then so on and so forth, 'di ba? So actually leukemia konti lang nga kasi mostly mga children lang 'yan. Pero breast cancer talaga ang marami, 'di ba? When you think of breast cancer, si Angelina Jolie, 'di ba? Nagpa-mastectomy talaga siya kasi she is at risk for breast cancer. So yan, we will talk about that later. So actually, breast cancer talaga ang pinakamarami dito. Both sexes yan, both male and female. But, ito, number of new deaths. So actually, the one with the most mortality is the lung cancer. So even though breast cancer is the most common cancer in the Philippines, lung cancer is the most deadly cancer in the Philippines kasi nga 'di ba lungs, it is really needed for our day-to-day life. Ang breast hindi naman siya essential, 'di ba? So pwede mo lang tanggalin yung breast, 'di ba? Pero ang lung hindi natin siya pwede tanggalin. So that is why lung cancer is actually the most deadliest cancer, than liver, than prostate, and so on and so forth. So actually breast cancer is not that aggressive, not that deadly, not that poor prognosis. Okay? So we are done with the cancer introduction. So let's go on to the tumor markers. But I will stop the video here first.